I'm here to talk to you a little bit about clinical alarms. I'm Kaylee Renzi, and my classmates are Colleen Riley, Brittany Pizzatello, and Ashwin Prasad. So, introduction. Clinical alarms are intended to call the attention of caregivers to patients when adverse conditions arise. Alarms improve patient safety. Users have the ability to turn on or off the alarms, as well as increasing and decreasing the volume of the alarms. Alarms must be visible, easily set, and easily identified when triggered for an action. Alarm information may also be transmitted to a location other than the bedside, such as the nurse's station. Users must be adequately trained, but the alarms have to work properly. Patient and healthcare providers rely on alarms to call attention to adverse conditions. Alarms substitute for the level of caregiver attention needed if the alarms were not in place. Alarms may be used as a primary source of information if the situation setting off the alarm is not directly observable, such as a patient with a heart condition. It is important that these alarms work correctly because they are so greatly relied on. If they don't work, we risk patients not receiving the care that they need. For the alarm to work, it must be set off by a problem which adversely affects the patient. Healthcare providers must be able to identify the meaning of the alarms and correct the event before the condition worsens.
This is Brittany, and I'm going to go over background. The first reported alert related to alarms was in 1974 and was reported by the ECRI. Studies have shown that there are a number of limitations regarding clinical alarms. These include having more than 6 different alarm sounds. People have a hard time learning more than 6 signals per patient. For example, it may be hard for a nurse to take care of multiple patients in the ICU. A nurse may have 3 patients, and each patient may have multiple alarms, making it hard to distinguish what alarm means what, having different meanings for each patient. Studies have shown that nurses cannot distinguish not even half of the critical ICU alarm sounds. Depending on the design of the alarm, tones can create confusion for nurses when determining high and low priority situations. False alarms are also a limitation for the clinical setting. False alarms are the most serious and common problem with clinical alarms, having high false positive rates. This can lead to nurses thinking that alarms are unreliable, giving the assumption that they are low priority if they go off too often. Improvements made in hospitals to help better care for the patients on alarms include keeping up to date with the technology of alarm systems and updating the alarms when needed, creating care management procedures, including alarm training, creating standards for care for patients with alarms, and then we're going to go over deaths involving alarms. There's a chart on the next following slide that pertains to this. In terms of death regarding the alarm devices used in a hospital setting, studies show that the highest rate of death by device is related to the physiological monitor, while the lowest rate is related to the bed alarm. The physiological monitor has the highest death rate because it monitors all the vital signs, which not only are critical to the patient's health, especially in an intensive care unit, but also because having more things to monitor creates more room for error. This is the chart that pertains. So here you can see that the physiological alarm has the highest death rate, and here is the bed alarm, which has the lowest. And we just have some pictures of the different systems used in hospital settings. So the first one we have is a defibrillator. The second shows a bed or chair alarm. This is like a heart monitor. The LVAD Heart monitor, obviously this is very important because it does deal with the heart, so any small error with this alarm can create a big problem for the patient. And this is the physiological monitor, which has the highest death rate. Obviously you can see that it could have the highest death rate because it monitors so many different things. So if one thing goes wrong, that could be a chain reaction to the next.
Hi, this is Colleen Riley. Now speaking, I'm going to talk to you about observations. In general, alarms are a tool for assessing patients and conditions with direct clinical judgments and measurements. It allows hospital and medical personnel to watch over the patient when they are not at their bedside. So it's a very good for them to have. And like any alarm system, a big observation was the false alarms that they noticed. False alarms reduce the confidence that the staff has for the alarms, and this could lead to possible deactivation of the alarm system, which would not result good for the patient or the hospital using this system. Recommendations. Hospitals and healthcare systems should recognize the limitations of the alarm systems and be able to know what they can and what they can't do. Understanding exactly what the system can and can't do will help medical personnel understand exactly what is going on with their patient and their medical system. Effective training in the medical personnel and educating them on how to use these systems properly is a very good recommendation so that your staff is trained on any false alarm or any alarm that the system is giving off they can respond to. And false alarms will occur, but this should not lead to result in deactivation of the alarm, and that's a matter that they would like to stress. They also recommend that this is used together as a system, so including the nurse, the doctor, the physician's assistant, and all other medical equipment. They would like them all to be used together and not just rely solely on this one alarm system. For future directions for the clinical alarms, they would like to develop improvement in them and identify any problem areas they have so they can work on them and make them better for the future. They would like to develop ideas to give to the equipment industry to reduce the number of false alarms and problem with the system. They would like to improve on any system error. They would also like a uniform display, which I think is a very good idea because this way you're only learning what display to use on all of your alarm systems, and you can keep the navigating and the educating to the system very simple. If a lot of your systems in the ICU or on the maternity floor are all the same, if you have a different nurse that day, they can immediately know what they're looking for. You're also going to want to enhance the emphasis and importance of training on the systems. Like I said, really knowing how to work your system, what to look for, is going to help your clinical judgments. And they would also like to stress to survey the systems frequently, just to know that they are working properly and to guarantee the best clinical judgment for the patient and the medical personnel.
Okay, and it's Ashwin here to talk to you about improvement efforts of alarm devices. So medical devices in healthcare have improved a great deal. In the past, devices only measured heart rates. Now alarms are multi-parameter devices, which can measure cardiac arrhythmias, alarm rates, pressures, saturations, concentrations, and many other things. Infusion pumps have improved as well. There is a dose error reduction setting on the pumps now that will set off an alarm if a nurse inputs an incorrect dose if that dose is outside of the prescribed dosing parameters. Alarms have improved drastically compared to the past. Devices now offer incredibly flexible alarm systems that are easily configured to allow hospitals to implement alarms in a unique way that helps shape the hospital's practices and protocols. Nuisance alarms can get irritating to the nursing staff, so device manufacturers have improved the alarm system to lessen the burden on nursing staff if the situation is not clinically alarming or dangerous for the patient. This new technology is called motion-tolerant pulse oximetry, which improves parameter acquisition techniques. So there are a couple of issues with alarm devices. There are constantly new devices or supplemental techniques being introduced to healthcare settings, which makes it hard for nurses because they always have to learn new technology. Another challenge for nurses is responding to multiple alarms. This can get overwhelming for the nursing staff. There are different types of alarms that can go off at the same time. A couple examples are physiological monitoring system, ventilators, infusion pumps, nurse call bells, bed exit alarms, and many others. Another issue is making sure the alarms are clearly audible for nurses, since hospitals can be quite large and there are usually many other sounds going on at the same time. Solutions to the previous issues. Due to many problems, manufacturers are now trying to come up with solutions to common problems. The aim is to consolidate and organize alarm information so it is more manageable to the nursing staff. Examples are integrating ventilators and other device alarms into a physiologic monitoring system or creating a communication system that accepts and sends out data from different devices. For example, like a physiological monitoring system sends a page to a nurse's pager, which lets them know that an alarm is going off. Okay, and this is our reference page. This concludes our presentation. Thank you all for listening.